name is John Robinson, and tonight I will be talking about Bell's palsy, some of the signs and symptoms of Bell's palsy, the causes of Bell's palsy, as well as the differences between stroke and Bell's palsy, and lastly, what they use to treat Bell's palsy. So some of the causes of Bell's palsy, it's idiopathic, so they're not really sure what causes Bell's palsy, but some possible causes are viruses and bacterias. Some viruses are herpes simplex, as well as Epstein-Barr, as well as a bacteria that's associated with Lyme disease. It's an Italian name. I'm going to butcher the hell out of it. It's like a Berghelia burgafatelli. Sounds like a delicious dish at your local Italian restaurant. Well, that's a bacteria, and that could be one of the causes that affects that seventh cranial nerve, inflames that area, and leads to that paralysis. Some signs and symptoms of Bell's palsy consist of hypersensitivity to noise, as well as that paralysis of the eyelid and the mouth. Mainly the area that's affected is the nasolabial part, right in this particular area, there's complete paralysis of that. Some differences between a stroke and Bell's palsy consist of a stroke. There's a lesion in that motor neuron part, which only affects the bottom part of the face, where in Bell's palsy we have two parts in the brain that are the contralateral and the ipsilateral. Contralateral has nerves in the upper part of the brain, which are connected to the upper part of the face and the lower part of the face, and the ipsilateral, which is more in the upper part. Both of those are affected with Bell's palsy, which leads to complete paralysis sometimes of that face, where stroke is only just usually the lower part. Some treatments for Bell's palsy, mostly cortisol steroids, which can help, and it can be cured within days or months. I had a patient, like I mentioned to you recently, that had I look back now and I see that nasolabium part right now, which was just completely affected, which I thought she was just messing with me, but something very important to look at when you get called on to a stroke